All right, so we're just letting folks get into the room. Just now started. Great. So we'll let people kind of pepper into the room. People may join a little bit late. It is a Saturday afternoon after all.
For sure.
So thank you so much for joining us for our mental health wellness session on the questions, answering your questions about finding the right therapist and therapy for you. We want to give thanks to Mallinckrodt Pharmaceuticals for sponsoring our wellness sessions. So I'm going to stop sharing that now. And it's my pleasure to introduce Sandra Manley Eichler. She's a licensed clinical social worker, and she's here to present with us today. And so many of you already know her, and so I'm sure you're excited to see her again. And Sandra, welcome, and thank you so much.
Thank you. It's my pleasure to be here. So I'm really glad that I could present on this subject because the process of finding a therapist is something that I answer questions about every single day. And I think it can be really helpful to just get a little bit of background information, as well as empowering yourself to be able to identify just any specific things that you might be looking for in the therapist for you, because the right kind of therapist for myself could be something completely different than who would work for you and sort of what you're working with. I will just start with just a quick introduction about myself. Like Mindy said, I am a licensed clinical social worker. My name is Sandra. I practice in a family medicine practice in the western suburbs of Chicago. So I'm considered an integrative clinician, which means that I both facilitate the ability for patients to be able to find the therapist, as well as doing therapy myself. So it's a really great blend of the two. I've been in practice since 2012 with a primary focus on chronic illness, PTSD, anxiety, and depression. I operate from a framework of cognitive behavioral therapy, dialectical behavioral therapy, as well as infusing positive psychology for some of those who may have seen some of the presentations that I've given before. We have a chat option in Zoom, so if at any point you have a question about something that I am talking about, please feel free to type it in. At the end of the presentation, after I've given us a little bit of a framework, we'll also have an opportunity for you to ask me questions. And I'll also start by answering some of the questions that have been proposed to Mindy and some of our folks at the Foundation for Sarcoidosis Research before. So let's dig in. So let's talk a little bit about what we're going to cover today. So what is therapy, right? And kind of giving a definition, what does it look like? And you may have heard about therapy from other folks, but maybe you're interested in what therapy means in the context of what we're talking about today. When and why should I go see a therapist? I'm going to give you a little bit of a counseling 101 primer on what the different types of therapies are. Some people don't really want to know much of the science behind it. Just have me talk to somebody and let me see if we have a good working relationship. But some people who are really interested in the different types of training that we as therapists have, kind of like those other therapies that I mentioned before, might be something that can help inform your search for finding the right person. And then personal considerations. So things that maybe you didn't know that you could ask for in terms of looking for a therapist, or sort of what might work best for you. And what you'll gain from today, or at least what my objective is confidence in finding the method for finding the right therapist, and knowing that, again, you can be empowered in making this decision. So for the purposes of this talk, we're going to be talking about talk therapy or psychotherapy. The term psychotherapy can be a little scary for some folks, but the reason that we use psycho, we're related to the Latin word for the mind, the psyche, and that's just differentiating that between talk therapy versus other things like physical therapy or occupational therapy. So the definition specifically from the American Psychological Association: psychotherapy involves communication between patients and therapists that is intended to help people find relief from emotional stress, such as becoming less anxious, fearful, or depressed, or in some cases, all of the above, seek solution to problems in their lives, such as dealing with disappointment, family issues, grief, or job or career dissatisfaction. So you'll know that when we're talking about this definition, there could be things that are more temporary issues that you might be struggling with, or they could be things that are more permanent. And other ways of modifying thinking and acting that are preventing you from working productively and just generally enjoying your personal relationships. So it maybe means that therapy might be initiated by recognizing that your effectiveness with other people, work, family, friendships, that kind of thing, is holding you back. Even if you feel like personally, you kind of feel pretty confident, you feel like the ways that you do things for yourself are okay, but maybe focusing on finding tools and techniques with your therapist to try to enhance those relationships. So that's a possibility as well. So therapy is going to look different and serve different purposes for different people. So you could have individual therapy. So that's one-on-one, right? You could have couples or family therapy, so multiple people or couples. And I personally really enjoy couples and family therapy. I think it can be very effective. I could have somebody who's seeing me for individual therapy for maybe 10 sessions to talk about how maybe they're dissatisfied with the relationship with a spouse or partner or with a family member, but sometimes bringing both people into the session or multiple people into the session or multiple sessions, of course, can be very effective, because there may be assumptions that one party is making, bringing that to the therapy session, but having the other person there to counter what those assumptions are can be very helpful. And we're going to talk a little bit about psychiatry, seeing if there is religious or spiritual help, group settings. So it's also possible that different therapists could be providing support groups. I know the Foundation for Sarcoidosis Research is really good about creating community support opportunities for the folks who are members and people who are just generally interested, friends and family as well. There are some really interesting new types of therapy that are coming about. Some therapists will do either walking or running therapy. Maybe you don't want to be just sort of sitting sedentary in an office with somebody or doing telehealth. You want to get outside and get going and out and about. Some therapists can provide that for you, so you can walk and talk. The type of therapy could still be the same, but the method with which you do it is a little different. Equine therapy is also becoming more popular. The use of interaction with horses for therapeutic purposes, which is not dissimilar to maybe what you might have heard in terms of therapy animals or emotional support animals, but a unique relationship because of the way that horses are bred. So lots of really interesting ways that you can sort of pick and choose. But again, therapy looks very different, but the whole point is that you feel like you're gaining something from it, whether it's for yourself or for your relationships. Let's talk a little bit about what therapy isn't. Self-care is really important, right? So the face masks, the going to get a massage, and interacting with ways of addressing your personal wellness is certainly a part of it, but it doesn't necessarily mean that you're digging into the foundation of why you're stressed out in the first place. So self-care, I think of as in conjunction with therapy or something to address your mental well-being. Physical activity, we love to see it, 10 out of 10. The endorphins are great, but they're also not going to be 100% addressing, like I said, the foundational reasons for which you may be feeling some anxiety or depression. Socializing and connecting with friends, right? So that's this sort of bottom image that we have here of some ladies having some cocktails. Our friends are wonderful for us if we feel like we can have connections with them. However, a therapist is not intended to be a friend. A therapist is somebody that you can talk about anything that is vulnerable or uncomfortable. I like to say that you want to have a therapist who you can talk about the things that you can't talk about with others at Thanksgiving dinner. So you want to be able to talk about politics. You want to be able to talk about religion, sex, things that are very vulnerable. And maybe sometimes we don't feel comfortable enough talking about it with friends, but with other professionals, we might feel like because they are somebody who is specifically there to address these different parts of our life, if we can feel that the person is providing a safe, non-judgmental space, then we can certainly do that. Hobbies and games. We all have different things that we like to do. I'm a big reader myself. I believe in bibliotherapy, the process by which we learn from books. So if you were to check out a book from your library that was talking about coping skills, things like that. So that's one element of bibliotherapy. The other is just the process of reading as a means to escape, as a means to provide self-care. But those things are not necessarily, again, addressing the foundational things that create some of our distress, whether it's anxiety or depression. Physicians and doctors, right? If you have good working relationships with your specialists, primary care physicians, they can really be a great resource to you, whether it's finding medications or finding resources for the thing that you're struggling with, but they don't usually have the requisite training to be able to provide the counseling support for you. Oftentimes, the nice thing too is that in therapy, the sessions tend to be about maybe 45 minutes to an hour each session. And I'm sure, as many of you have noticed, is that sometimes you may not get that much time with your physician, even if they can provide a little bit of mental health guidance. So therapy is intended to provide you with a trained professional who has more time to address those issues. Why and when to start therapy? So is therapy right for you? Yes. I come from the perspective that therapy can be good for anybody. And a lot of folks who come into my practice typically will say things like, I thought that I should just handle this on my own, or I don't think that what I am suffering with is enough. It's not enough. Other people are struggling with things that are worse than what I'm struggling with. But really, it is the therapist's job to determine if you have adequate coping skills or if there could be some benefit to having somebody to speak with on a regular basis. Again, going back to that piece about Thanksgiving dinner, right? A mental health professional might provide you with that safe space to talk about things that are really bothering you when maybe the people in your life aren't doing that. I did have a woman who came to me maybe a year ago, and the reason that she came is because her family had prompted her by saying, well, we disagree with how you're handling COVID so much that there must be something wrong with you mentally. You should go speak with somebody. But really, we found that she was mostly feeling happy. She felt confident in the decisions she was making. And she didn't really think that she was having as much distress personally, but was more interested in working on the relationship with her children because they were having such disagreements about how they felt about COVID. And so she decided at that point not to continue seeing me because her family wasn't as interested in engaging in family therapy, but she felt personally comfortable enough that she didn't want to work on things. But I think it was even just a couple of those sessions to understand that there wasn't anything wrong with how she was processing. So even just initiating therapy and having an objective third person to talk to can be very helpful for that. But we don't have to reserve therapy only for crisis circumstances. It can be anytime you're just kind of generally struggling with something, or if a family member is suggesting that it might be helpful. Therapy can be used to talk about individual issues, like I said, struggles with your relationships to your family, or just general adjustments to transition. So as you can imagine, therapy has been significantly more popular over the last year and a half to 2 years, because one of the biggest transitions we've had to manage has been the global pandemic. Many people are navigating COVID-19 as a global trauma. We overnight, it seemed, kind of had to change a lot of the different ways in which we lived. And because of that, we can all be struggling with various types of adjustments. So with that, therapy can provide a space to sort of process and talk that out. So when should I start therapy? And again, like I said, a lot of people tend to wait. I think I'm doing okay now. I'm handling everything now. So I'm going to wait until things get really bad. And then maybe I'll pursue seeing a therapist. So I want you to think about what it's like being a marathon runner. I don't know if anybody is a marathon runner on this chat. And one of the reasons that I wanted to bring that up is, so let's say that you have this marathon training plan. You're not going to just go from, well, I'm thinking about it, and then do no training and then just try to run the race. Wouldn't be prudent to start a marathon without any training, right? So what if we treated our mental health the same way? Instead of thinking that we needed to reserve any kind of mental health training, let's say, for crisis, or only when things are going to be really bad, we can build psychological endurance by talking to somebody as soon as we think that it could be helpful. And in therapy with my own patients, I talk with folks about wanting to nip things in the bud, to not wait until you're feeling really distressed before trying to work with appreciating some of the things, the triggers that you may have, whether it's for, again, depression, anxiety, or what have you, and not waiting until it gets especially to a mental health crisis. And part of that is because, with a marathon, you might have it scheduled for a very set time, but we don't know when mental health crisis will happen, whether it's due to a setback with our treatment, or maybe it is a family discussion that we didn't think was going to be much of an issue. I just had a patient come to me a couple of weeks ago who was doing okay generally with the family, but now with the holidays coming up, they've started to argue a little bit more about what their plans are, again, because of differences in how they've managed with COVID protections. So she had been seeing me for other things and had felt like she was doing pretty well, but came to another mental health crisis because of this family struggle. So again, having the therapy before it gets to that crisis can be helpful because, like I said, you can nip those things in the bud. How do I find the right therapist for me? So I'm going to take a paradigm that's from one of the bloggers from the Psychology Today website. Psychology Today, for those of you who don't know, is actually a magazine that's been around for a long time, but has kind of emerged into this resource for many people who are looking for a therapist, with articles about what different types of therapy are, in addition to a therapist directory that you can look at so you can be able to identify people who might be a good fit for you. And we'll talk a little bit more about that later. So we're going to be looking at research, interviewing, and then building rapport. So before you go into the process of finding a therapist for yourself, you can look at, what are your preferences? Do you want somebody of the same gender? Is this person somebody that you want to have in your insurance network? And what kind of therapy do they provide? And are you interested in a particular type of therapy? Excuse me. And whether or not you can interview your therapist, it's a little bit different than maybe meeting with a physician or a doctor. It's rather nice. Most of the time, we can actually interview the therapist before we even have that first appointment. And I do encourage people to do that. Sometimes you might be doing more of that kind of interviewing the first time you meet with them in person. If there is somebody who is an intake specialist at an office, meaning that they gauge what your concerns are and try to match you with the right therapist based on their expertise, then you may not have a chance to interview that therapist until you have that first session. But if you have that first interview with them and talking with them, and you determine that it's not really a good fit, that's okay. You can always move along and go to the next therapist. That's all right. And then use your feelings as a gauge for whether or not you want to proceed. Do I feel like I'm being understood? Do I feel like the therapist is listening to me? Do I feel like we have a connection? Some people, when they go to therapy, they want it to be a very serious environment. You know, I'm talking about very serious things. I want somebody who's going to be very maybe stoic or reserved, right? And that's a kind of stylistic thing. Whereas with your friends, it might be a little different. Or do I need somebody who's going to be a little bit lighter, a little bit more humorous, maybe call me out? Those are the kinds of things that you can kind of gauge for yourself as you start to develop rapport. And that can happen in the very beginning of when you start to work with therapy. Sometimes I've had people who say they've worked with a therapist for several months and it seemed like everything was okay. And then after maybe one conversation, they didn't feel like that therapist really addressed things very well. And if that is the case, then you can address that with the therapist. You know, you mentioned something in our session last week that kind of made me feel uncomfortable. Or again, if it was something particularly egregious, you can make the decision to stop there too. But I don't think that happens as often. If necessary, you may have to repeat this process. So you can stop the therapeutic relationship at any time. Nobody is going to force you to go. And that could be you can decide to make that conversation with the therapist and say, for example, you know, I'm in my 30s. I have some patients who don't want to work with somebody that young. And so they might say, you know, Sandra, you seem like a great therapist, but I don't feel like we can connect with each other because we're at different stages of life. And I am not offended by that. That's not something that a therapist should take personally. None of us can control when we are born, and none of us can control if that's a thing that's going to be a hindrance to the relationship. You want to make sure that the person makes you feel heard. So sometimes if that's the case where you feel more heard talking to somebody who's closer to your age, then that's perfectly fine. Alternatively, I meet with patients from as young as 16 to as old as I think the oldest patient I've ever had is about 90. So to also not necessarily rule out age unless you really think that it's something that's going to be an issue for you. And as we always like to say, as the song goes, my mama told me, you better shop around, shop. Just a little singing in there for you. But I think that it's something that you can empower yourself to continue looking for the right therapist for you. So communities, you know, so sometimes we want somebody with whom we feel that we can identify from a community that we belong to. So for example, if you identify as LGBTQIA, you might want to have somebody who specializes in affirmative therapy or who has even disclosed that they are a part of the same community, the same member of the alphabet as you, because that might give a certain special credential or trust in that person because maybe they've been there. It's not uncommon for people who are looking to come out publicly to their family to want somebody who's also had that same experience. Same with maybe parents, people who have been divorced who are pursuing divorce. That could be one other community that you could be searching for. If you're a veteran, maybe you want somebody who has experience with the military. This is something that you can also search for in Psychology Today, but you can also interview the therapist as you're talking with them. I think it's really important that I meet with somebody who is supportive of veterans and who has experience working with them. We have unique issues that are different from the general population. So that's something that you can ask about. First responders. So if you yourself are a healthcare professional, or if you know somebody who is, or maybe even if you're retired, you know, the things that you may have experienced as a healthcare professional, maybe you want somebody who can help you identify boundary setting and navigating the work stress that you have. This is becoming a new specialty, especially in the age of COVID. And like I was saying before, you may not feel comfortable meeting with somebody who isn't in your age group. And I think that that's important. Some of that also may be related to years of experience. You know, maybe you have some very complex issues that you're thinking, you know, I really don't want somebody who's a recent graduate. I want somebody who's been practicing for several years. And maybe that's the reason you feel more comfortable. But to acknowledge that whatever it is that you're feeling, you need to bring it out there and see if the therapist is going to meet those needs. It's been something that I think, especially over the last year and a half, although has been increasing in the psychological community for some time, is making sure that people in special populations and communities feel like they can meet with the therapist who meets with them to their racial, ethnic, or cultural identity. I'm a white woman and I cannot change that. And if there's somebody who wants to meet with somebody who is in their community, I would never begrudge them of that. So if the patient comes to me and says, you know, Sandra, you seem great, but I really want to meet with a Black woman because I'm a Black woman myself and that makes me feel more comfortable. She's going to have the experiences that I have. And I'd say, absolutely, let's make sure we can help you find that. And that's okay. And if it turns out based on proximity or insurance limitations, maybe it's harder for you to find somebody who's within that community, then you need to feel empowered to talk about the elephant in the room. That, hey, you don't look like me. You don't know my experiences. How are you going to manage this in our therapeutic relationship going forward? I often start the conversations with my therapists who do not share my same ethnic or racial identity by saying, hey, I carry white privilege with me. And that's something that I have. I may overstep, I may say things or make assumptions, but I'm going to actively work on that. And I say that from the very beginning when I meet with somebody who doesn't look like me. And I think that that is something that we can build on those relationships as long as we feel like we can be vulnerable enough with them. Because if you were to have a conversation like that and that person was denying you your expression or maybe other things that you may have faced, discrimination, profiling, that kind of thing, you're not going to feel like you're going to be very supported by that therapist when you talk about what else is happening in your life, the things going on in your family, work, how you're coping. So to empower yourself that those are conversations that you can have, and these are things that you can ask for. I'm very lucky that, like I was saying, I work in a family medicine practice, and even my physicians are in the practice of when they refer me to help somebody find a therapist, they will say prefers non-binary or prefers a Latin therapist, prefers a Black therapist, whomever. So again, empower yourself to be able to ask for that in your search. And to know, and I think it's important too, even if that person matches your experience, to make sure that that person does not feel that they are presuming that they know your experience. For example, I'm Polish. You know, I come from the Chicago area. It's not uncommon that you find Polish people, but just because I'm Polish and if I meet with a Polish person for therapy with me, doesn't mean that I'm going to know everything about their experience. And there may be some elements, whether it's religion or how we've been brought up, or even cultural and general history, that doesn't mean that I can assume that I know what's happening. And so again, even if you do end up finding somebody who you feel is a good match for you from a racial, ethnic, and cultural identity, to make sure that you also check in with them if you feel like even they are making assumptions about those connections. So where do I get started? Like I said a few times, you can ask your physicians for any recommendations. Some offices just kind of have a list of names, right? And that may require you to do a little bit of strategic Google searches after the fact, or you might be able to ask the physician, do you have somebody with an expertise in this particular issue? Excuse me. But you can sort of work with that. Maybe it's not a trusted medical physician. Maybe it's a dentist. A lot of dentists actually have lists for things like this because of a lot of the anxiety that people have in getting dental work. So you never know. It's really, who do you trust in your medical community to be able to search for that? Your insurance company, just like we have on the bottom right here, even online, we have a lot of places where you can look for particular kinds of therapy, and just making sure that you identify the kind that you are looking for. So if you look in the little screen here, we have ABA therapy that's specifically for people with autism. Behavioral therapy is going to be doing more of the talk therapy. Couples therapy, self-explanatory. So just making sure that you're trying to look for the thing that's going to help you best. Like I was saying before, Psychology Today has a great find a therapist function, so you can specifically look for that. And word of mouth. Hey, anybody have a good therapist I can see? We can use social media. We can use just the people that we're really close to. It's really nice that I think over the last couple of years, the stigma for finding mental health has been decreasing. So it's not really embarrassing to share with people that you're looking to find a therapist. And in fact, you may be surprised at the people who have already seen therapists before. I had an experience where I had a couple of my patients tell me that they were feeling a little bit more reserved about who they were telling about their therapy experience. But after maybe a year or so and feeling better, when people would identify, you know what, you seem like you were going through a really rough time last year, but now you seem better. What have you been doing? Well, I've been seeing a therapist, every week or every other week for the last year or so, and it's really been helping. And that usually opens the door for that person to disclose, oh, that's great. I also saw a therapist when I was going through a divorce, grief, what have you. So we're having more of those conversations with each other as friends and family. So I think that's becoming more open. But gauge whatever feels comfortable to you. If you still want to keep it more personal and private, listen to yourself for that, and then make sure that you follow up with somebody else or going online or to somebody that you care about or that you trust and who cares about you to be able to find the right therapist. So how do I pay for therapy? What's covered? So again, oftentimes therapy is covered by health insurance plans. It's labeled as behavioral health. So if you are, let's say, from an employer or even just a explanation of benefits perspective, you can look into behavioral health to determine what's covered from there. Some of the information on the insurance websites may differentiate between residential, inpatient, and outpatient. So residential is typically if you're going to a facility to live there to get therapy. It's typically reserved for substance abuse or eating disorders. Inpatient is if you were hospitalized, meaning that at some point your mental health was so severe that you were at risk of harming yourself or others. Outpatient means typically you're at home and maybe going in for maybe once a week or twice a week or less frequent sessions with the therapist. If you have questions about that, I've also encouraged people, because it's been harder sometimes, I think, to wait on the phone while you're calling insurance companies. If your insurance has a online option, maybe a member profile for you to log in, or an email address where you can send questions and things like that about your coverage, you could say, hi there, I'm looking to meet with a mental health counselor. Could you help me understand my behavioral health benefits? And that may give you an idea as to what's covered. Many times they will let you know, okay, for an in-network provider, you get either a number of sessions per year or a certain copay that you need to pay before each of those sessions, but they'll be able to explain that a little bit more. Folks with a HMO plan may, like I was saying before, have to go through their physician to get that referral. I have a lot of HMO patients who will be restricted to 12 sessions, but that restriction is actually something that I can work on. I, as the therapist, can appeal to the insurance company to get more sessions approved. So that is a possibility. If you're struggling to find a therapist who's in network, or if your insurance is not widely covered by therapists, they may offer sliding scale coverage. And so what that means is they offer a discounted rate based on your income or other financial factors. And that could be something that you look into either with private therapists, or it could be a nonprofit organization, or like I mentioned here in one of my other bullet points down here is checking with your local hospital to see if they have financial assistance for outpatient therapy. And that could be whether you need full coverage for the therapy. For example, does the hospital provide a set number of free sessions for patients? Or is this something where you can get financial assistance for your insurance copay or co-insurance. So even if you have insurance coverage, that doesn't mean that the financial assistance is only for people who don't have insurance coverage. If, let's say, you have a copay of $20 to $50 per session, and then you're struggling to pay that other portion, the hospital or the organization that the therapist is employed in might be able to help you with that. And that could be a payment plan, that could be a discount. It means so many different varieties of that, but you want to make sure to research it so you're not paying more than you should. The other thing too is that local universities, if you are near a school, they may provide free interns that can provide therapy for that. And a lot of people may say, again, kind of to my point before, well, do you really want to meet with somebody who's that young? And that's a generalization too. There are a lot of interns who are going into counseling programs as part of a second career choice. So it doesn't guarantee that seeing an intern means that you're going to see somebody who's maybe a new undergraduate just starting their graduate program. And we all need to start somewhere. A lot of my prized relationships with some of the patients that I've worked with have been from when I was working as an intern. And even if you maybe feel that they may not have the same caliber of expertise that maybe a seasoned professional does, I will say that they do have a lot of enthusiasm and a lot of energy. So they may be even more than the seasoned professionals willing to dig deeper and make sure that they research exactly the kind of therapy that could work for you. So to not discount them and their services too. So navigating telehealth. It's the age of COVID-19. Overnight, we had to go from meeting with people in our offices to being able to provide telehealth through phone or video sessions. And this has been essential for people to get access to talk therapy. It's helped to remove a lot of barriers, things like transportation issues. A lot of folks with agoraphobia, those who have difficulty leaving their homes, have been able to get access to care. And this is something that can be really helpful. And so especially for folks on the call who are struggling because they feel as though they're significantly more immunocompromised. The concept of going into an office with other people can be very scary, and we don't want to be risking exposing ourselves to something that could make us sick. But we also want to make sure with telehealth, we have to look into your lifestyle and whether or not there could be a schedule or location change for you. So I had a lot of folks during the last couple of years who were working remotely from home and had a pretty flexible schedule to meet with me, especially my office hours are during the daytime, who then had to go back to their offices and no longer had that flexibility. So you're going to want to talk about, if you anticipate some of those barriers or issues, you want to talk about that ahead of time, just because if there could be any kind of disruption to that therapy, that's really going to impact your ability to have some continuity with the same person. Again, this could be due to distance. Maybe if my insurance is no longer covering telehealth, that's my last point here, then needing to physically travel to somebody, maybe that's going to be more prohibitive. I was working with a patient who lived 2 hours away from me. I can't imagine that if her insurance wasn't covering telehealth anymore, that she'd want to see me. She might need to transition to somebody who's closer to home. And also too, are there structures in place in your position already that make it a little bit different? So teachers or professors, instructors are often, their schedules are based on the time of year. They may have summers off when they have full flexibility, but then as soon as the school year begins, they're working a lot more lesson plans and that kind of thing. So make sure to talk through any of those lifestyle changes before anything happens and before you get started with that therapist to see if it's going to be sustainable long-term. So this is what we've talked about so far. So what is therapy? What therapy is not? Again, the Psychology Today paradigm is research, interview, and then build rapport. And again, that process can be repeated if you absolutely have to. We took an emphasis on community, so looking at different types of people and what you might feel more comfortable with in terms of your work with a therapist, insurance coverage or non-insurance coverage and what that looks like, as well as navigating telehealth. And so I wanted to make sure I did a little crowdsourcing, I think, before I was doing this presentation. And so I asked many of my own friends, when you were working with a therapist, what are some of the things you wish you had known before going into it? And the biggest one probably was that you can switch. And so if you're meeting with a therapist for a period of time and you feel like you're not really gaining as much out of it, and you want to meet somebody else, you don't have to necessarily tell the person. It's helpful, I think, in terms of if there's something that maybe you just haven't had a chance to talk about something yet, and you want to refocus that instead of what you have been talking about. And that could be one way of addressing the therapist. And maybe once you've addressed the reason that you're thinking about going to somebody else, they might be able to say, oh, well, we can definitely work on that. Let's keep this going. But you get to make that decision whether or not you want to have that conversation. It can be kind of awkward sometimes. So I've had many patients just leave out of nowhere. Again, what may seem rude in some places in therapy is understandable. It can feel really uncomfortable for people to sort of approach that. And it's kind of awkward to say, you know, Sandra, I'm really not interested in meeting with you anymore for therapy. I'm going to go to somebody else. We understand that coming from our sensitive place in mental health. So just to know that we don't perceive that as rude, at least I don't. And I had a lot of people asking me, well, I wish I'd known more about the types of therapy. And I'm just going to give a very brief overview. There are so many different types of therapy that is performed out there, but I think these are probably some of the most common. And again, the nice thing is that with all of this, everything that we're talking about today, you can still ask the therapist more questions. What does this particular type of therapy mean? And why are you doing it? So for example, I mentioned before, I am a cognitive behavioral therapist as well as a dialectical behavioral therapist. So I once had a patient ask me, you know, you don't really ask me too much about my childhood. That comes in every once in a while, but that's not the main focus. That seems a little different than what I've seen with therapists on TV, right? And part of that, I was able to use that moment to discuss a little bit more of my training and why that is. But if you have a little bit of a framework for how therapists work, it might help empower you when you start to do some of that interviewing and rapport building so you can determine the person who's right for you. So let's do this. So let's figure out first, what do those letters mean at the end of the therapist's name? You know, what are our different types of credentials? And so the folks who are doctors, the psychologists, they can have a PhD, a PsyD, or an EdD, educational doctorate in psychology, meaning they've completed their doctorate degrees and typically have some kind of dissertation or research that has been behind their credentialing. So those are doctors. Others, like myself, I'm a licensed clinical social worker, but many of my colleagues are also licensed clinical professional counselors or licensed marriage and family therapists. And these are mostly master's degree clinical roles, and these are some of the licenses that you can look at. If you're at a practice and you see somebody that has a shorter suffix or licensure at the end of their name, an LSW, LPC, etc., that usually means that that person has completed the master's degree, but they're in the next stage of looking to receive supervision to get to their clinical license. There may be some benefit to meeting with those folks who don't have the full license because oftentimes they may not be billing. So if you can find an LSW or LPC who's receiving supervision from another practitioner, you might be able to get a cost break there. So just something to think about. Again, just like with everything, it's all relative. The person who you may perceive as maybe not having as many years of experience could still be somebody who's a really good fit for you, both for a financial purpose as well as being able to provide a great level of enthusiasm and support for you. And anytime that you're in doubt, just ask. There are a lot of really interesting types of certifications, and therapists are always happy to explain where that certification comes from. An OSWC, for example, is a oncology social work certification. So if you're looking for somebody who also has experience with cancer, that's a kind of licensure you're going to look for. However, it's much more rare, but it's still, those letters have meaning behind the person's name. So just make sure to ask the person if you have any questions about that. The other thing that I will say, because a lot of people will say, well, why can't I just see a psychologist? Doesn't that mean that they have more clinical experience? And that's not necessarily true. Many times the master's level clinicians will have just as much, if not sometimes more clinical training than the psychologist. But again, the psychologist is just going to have more of that research background. And we'll get into this as well when we talk about psych testing. Folks who complete different types of validated measures to help determine what your diagnosis is, those are typically going to be psychologists because they've had added training in that. But just seeing a psychologist doesn't necessarily mean that they're going to provide a better or more thoughtful and rich educational experience when it comes to the counseling part of the background. It's the most important thing is just whether or not you feel like you can be vulnerable and you feel like you can trust the person with the therapy advice that they are giving you, or guidance, I should say, not advice. Okay. So what's the difference between a therapist and a psychiatrist? I have a lot of people who are referred to me to help them find a clinician for themselves. And they may say, well, I really want to meet with a psychiatrist, but maybe the referral from the physician is for a therapist. And so I'll have to say, well, do you mean a therapist or psychiatrist? And usually what the person says back to me is, well, what's the difference, right? I nobody's really taught me what that means. And typically psychiatrists are medical doctors. So they are going to be focused specifically on medication. So that's the primary difference between a therapist and a psychiatrist. So just like your specialist that you see, maybe your pulmonologist, your primary care physician, a psychiatrist would have gone through the requisite foundational medical training, but then decided to choose mental health as an area of specialty. So these are folks who are going to be specifically focusing on medication management, mostly rather than talk therapy. There are some psychiatrists who still do talk therapy as well as medication management. I have an uncle who we both talk about mental health quite a bit. He's a psychiatrist and he still does do talk therapy in a private practice. So he does the counseling element, but then he can also prescribe medication at the end of the session. However, this has become increasingly more rare. We currently have a psychiatric shortage in the country. So we are finding that the psychiatrists are deferring the talk therapy to folks with a doctorate or a master's level so that they can make sure that all of their time is focused specifically on medication management. But again, that's something you can ask the psychiatrist as well. And to know that the office where you are referred to, you may not be necessarily connected with a psychiatric medical doctor, somebody who has that MD, and rather with what we call an advanced practice provider, a nurse practitioner or a physician's assistant who works underneath the physician and still has that medical knowledge, however, may not have, let's say, inpatient duties where they have to do rounds or maybe consult with people who are currently admitted to the hospital. And what that means is that those folks may have more availability for you to see them more regularly to talk about your medication management. So just to know, if you call an office and they do not refer you to a doctor, that doesn't mean that it's a bad thing. If anything, it may mean that you get to see that person and ask more questions of them more frequently. Let's talk a little bit about spiritual counseling. So some people really feel very connected to their spiritual or religious identity, and they prefer the company of clergy or religious leaders for their therapeutic needs. Many times clergy have completed some form of training in pastoral counseling, and some of them even have identical credentials that the therapists do. So it's not uncommon for you to see somebody who is a member of the religious community who has an LCPC. So they've not only done the divinity training, but they've also done some psychological training as well. So you can certainly ask them if that's something that you're interested in. And that's typically, that can start at your synagogue, at your mosque, at your church, at whatever place it is that you feel most comfortable discussing that. And that could be something, there are a lot of places that provide support groups and counseling as a part of their church. So there could be support groups and things like that. But again, that the focus is going to be coming from a more religious point of view. And maybe you're thinking, well, you know what, Sandra, I do feel very strongly connected to my religion, but I don't know that I need religion to have a primary focus. However, I want to meet with a therapist who's going to understand my cultural and spiritual beliefs. Maybe I don't feel comfortable, say, as a Jewish woman going to a Christian therapist, even if I'm not particularly feeling any kind of distress about my faith or my religious beliefs. It's just such a part of my everyday life that I don't want to have to keep explaining what my various customs, holidays, or that kind of thing are about, so that you don't feel like you have to necessarily educate the therapist on how your religion impacts your life. And so that's something that, again, kind of like what we were talking about with the racial conversation before, is that you can have that conversation ahead of time. I practice in this particular faith. Is that something that you have knowledge of? Or is that something I'm going to have to teach you about in order for you to understand me more? And if you feel comfortable doing that educating, that's great. If you don't feel like it, then you can look for a therapist who has that kind of availability and understanding. The other thing I also want to highlight is that oftentimes chaplains in hospitals are known for their inpatient support for people if they are in the hospital for a long period of time, if they are not able to physically get to a place of worship and want to have that chaplain to facilitate that kind of spiritual connection when they're in the hospital. However, many hospital chaplains offer outpatient visits as well. but it is just not as advertised. So if that is something else that you're also looking into, again, chaplains are kind of the best of all worlds. They have specific spiritual and religious training, and many of them have gone through the particular requisite educational training as well as the certifications that are required by the state that they're in. So if that's something that feels more comfortable to you, that can be something that you can ask about at your local hospital. They will often have a chaplain office. You could just call them and say, hi there, I'm looking for some spiritual counseling, but I'm not currently in the hospital. Do your chaplains provide any kind of outpatient support? I wanted to make sure I brought up psychological testing. So this can be recommended often by physicians, especially if you're having some symptoms or if you've had symptoms for a long time, but you haven't really been able to get a firm diagnosis. So one of the examples that I mentioned here is for a lot of folks who struggle with attention issues, attention and concentration issues can be symptoms of both anxiety and depression. But if you're thinking, well, this is something I've been struggling with for a long time, maybe I have ADHD or attention deficit hyperactivity disorder. These kinds of tests and measured tests can be very helpful for getting a formal report that tells you what it is that you could be suffering from. This is one of the few things that we have in the mental health world, because we don't have things like you would for other diseases, blood tests, or there is some research that's getting more traction for brain scans, but even then, we don't really have anything that's as concrete. So these tests, which are validated and verified, and then again, completed by psychologists or psychiatrists who have the training in order to be able to measure the outcomes, can be very helpful if you feel like, okay, now I finally have a formal diagnosis. That diagnosis I take with me to help find a therapist who has expertise in that. So to know that you can use that to empower you as well. The testing is typically covered by insurance and will take anywhere from 1 to 3 to 4 hours, depending on how many different diagnoses you're trying to narrow it down to. And when that does happen, the therapist, or I should say the psychologist or psychiatrist, then takes the results of that testing and then will produce a report to you, usually within about 1 to 2 weeks, unless they're especially busy, and then it might take a little bit longer. And you can do a couple of things. You can take that report and then bring it back to your primary care physician, who could then also prescribe the psychiatric medication. Something I should have mentioned before is that a primary care physician or specialist can also prescribe that medicine. It does not have to be a psychiatrist. It can be especially helpful if the psychiatrists in your area are very booked, or if you're having some difficulty getting a meeting with them. But it really just depends on who it is that you're working with. If you already have a psychiatrist, or if you have maybe a general practitioner that you're using who could be able to help with getting medication for whatever it is that you are prescribed. And it isn't just about medication. It could also be about finding the right therapist, like I said. So what do you expect? How do we, when you are about to call somebody, a lot of my patients and the people I work with will say, well, what happens now? I have a list of names. What do I do? Well, it just starts with a simple phone call to an office. Again, there may be an intake specialist, meaning somebody who specifically will ask you, what have you been suffering with? Well, I think I have trauma from my childhood that I want to process. It's been a while. Or I have concerns about my depression. I've been really struggling to sort of get out of bed in the morning, that kind of thing. And depending on what you explain to that intake specialist, they may say, okay, I think based on what you told me, this particular therapist in our office might be a good fit for you. Or again, that phone call could be directly to a therapist. I was referring a patient for psych testing the other day, and he said, I was a little caught off guard that it just went to a straight personal cell phone. That's not uncommon, especially for people who are in private practice. Many times they say, well, why would I purchase a personal cell phone plan and a separate business plan? I'm just going to combine the two of them together. So then you'll have access to that, which is kind of nice. If you have an HMO insurance, just like I mentioned before, you might have to start with your primary care physician. Traditionally, you meet with a therapist once a week, and then those sessions decrease in frequency as you and the therapist continue working together. And hopefully you start to see your symptoms improve. I had a friend of mine who said that she was going to start meeting the therapist, but genuinely thought that once a month was going to be sufficient. But then her therapist said, one of the reasons I want you to come in once a week is so I can get to know you. I want to know your history. And then even if you're not feeling that distressed, I still have that foundation from which I can build upon, even if we are only working with each other about once a month. And certainly there are people who I've met with who the severity of their symptoms seems quite light. And thus we we may start by only meeting maybe once every other week to get started. But just to know that the once a week paradigm is pretty common and typical. If you're specifically looking to meet with only the psychiatrist or somebody for medication management, those sessions are usually less frequent, especially because a lot of the medications can take maybe up to a month to start working, especially things like antidepressants. So meeting more frequently when we're still waiting for that medication's effect to go through doesn't really make sense for you or that other person. And the other thing is that, a lot of people ask me, well, who do you think I should meet with? Should it be a therapist or a psychiatrist? And it doesn't have to be an either or. Many people end up meeting with both. So maybe you're meeting with your counselor weekly, but then you meet with a psychiatrist, say, once a month, to start with, and then less frequent as that continues. Then you start meeting with them maybe once every 6 months to a year, once you get to a good ratio with your medication. And whether it's with therapists or psychiatrists, I always say, don't get discouraged by wait lists. We have seen an unprecedented demand for therapy these days. And because of that, those wait lists are there, but people are also completing therapy at, rates that are also depending on what office you're in, of course, but to know that people do stop when that means that provides a slot for somebody to get in with that therapist later. So don't get discouraged, put yourself on the wait list, even in multiple offices. And that's okay, because if it's going to be somebody who, let's say, is in network with your insurance and it fits those other criteria we were looking for, then it might be worth the wait. It's another good reason not to push your interests in meeting with a therapist until crisis, because if it gets to crisis and there is a high demand for therapy in your area, it's not going to be as easy for you to get in to meet with them. So just something to think about. So let's get into the nitty-gritty of what those types of therapy are. So let's just start with psychodynamic. This is probably one of the oldest forms of therapy that is still in existence today. It is an approach that's just loosely based on the traditional psychoanalysis that you would have heard about, being spearheaded by Sigmund Freud, focusing on the interaction between our conscious mind, our unconscious mind. So what can we actually experience in reality today versus what might be hidden underneath the surface. And the idea is that this particular theory is based on self-reflection, examining impulses and where they come from, with a strong emphasis on how our past influences are thinking. There may also be sort of a deeper exploration of interpretation. So for example, dreams or memories that seem to pop out of nowhere, or word association. And what that means is that you're going to be reflecting on, again, things that have happened in the past and how they influence you now, as well as making connections for, wow, doctor, I had this really weird dream last night. Okay, well, let's interpret what that dream means. So if you're the kind of person who just is very cerebral, meaning you're the kind of person who likes to think about thinking, this might be a really good therapy type for you. And especially, again, if let's say if you've had psychoanalysis or psychodynamic therapy in the past, it's really an opportunity for you to do a lot of the talking. So if you're a talker, you're somebody who really wants to get a lot of what's on your mind out and about, this is going to be a good therapy approach for you. And so cognitive behavioral therapy, founded by Aaron Beck, and addresses thought patterns. Sorry for the typo there. So we're looking at the connection between your thoughts, your feelings, and your behaviors. And the idea behind this particular therapy, and again, I am a cognitive behavioral therapist, we're looking at challenging or reframing automatic thoughts. We go through life and we have certain reactions to things, but because it's so automatic and so quick, therapy allows us to slow down enough to identify what those different thoughts or feelings might be. And part of that could be related to what we call core beliefs. I am unlovable, I am ugly, I am stupid, all these things that we sort of learn about ourselves, but maybe we just don't understand that that's what's motivating our particular feelings or behaviors. And the idea behind this is we want to try to change some of those things. This is a very change-oriented therapy modality. And the types of things we could be talking about could range from maybe challenging some of those core beliefs. Well, I hear that you're saying that you feel that you're unlovable. Well, what evidence do you have to support that particular thought? Well, nothing. Okay, well then let's talk about where that thought comes from and how we can challenge it and sort of identify, can we replace it with a maybe more neutral or positive automatic thought in its place? in addition to encouraging supportive behaviors. So for example, our behaviors can sometimes influence our feelings. So if we are feeling very depressed and we sit in bed all day, that could further exacerbate the feelings of depression. And so one of the things that we may recommend for our patients is something called behavioral activation. Make sure you do at least one thing every day. Make sure you do at least 2 things every day, and so forth, because that is going to counteract the depressive thoughts and feelings that you have. Dialectical behavioral therapy, created by Dr. Marsha Linehan, based out of the University of Washington. This is one that's going to be focused on the idea of skill building. So coping skills, navigating emotion regulation, and then implementing mindfulness and thinking about the present moment. So Dr. Linehan did a lot of work with folks who were chronically suicidal. And one of the things that she found out was that many of the people who were in that predicament really struggled to find the ways to cope with their very extreme emotions. And so this particular therapy modality is going to be, rather than assessing thoughts, which are certainly part of it, is also going to be talking about when you're feeling very emotionally unwell, making sure that you have additional skills, tools in your toolbox to be able to handle those emotions, as well as interpersonal effectiveness and connecting there. One of the other things that we're going to see is a connection between identifying what's the difference between your emotions versus with your, sort of more logical, reasonable mind. Sometimes I call this like robotic mind. And the idea is that we don't want to exist in one of those 2 minds for too long. We want to be integrating the 2 of those. So we want to be able to see, I can express my emotions and I can appreciate them, as well as the logical piece. And I just had a comment here from a participant. I have trouble with being exhausted. I push myself to walk every day, but it's been challenging taking care of myself. Thank you for such a vulnerable comment. I think that you're certainly not alone. Sometimes that can be just from chronic illness in and of itself and the sarcoidosis, right? Fatigue is a very common side effect. And to that, I think we also need to appreciate that sometimes behavioral activation, especially from the therapeutic standpoint, is not talking about exercise. It's not talking about only motivating behavior that seems like it's good enough. Sometimes behavioral activation is just making sure that you shower each day, right? Or that you go out and get yourself a cup of coffee or get some dinner that day, maybe. So, and I also kind of working through and challenging if you feel as though that's not enough. I should be walking more often. Well, if you're struggling with a chronic illness, that should is very relative, right? A lot of the expectations that we have on people are based on context of their health. I was working with a patient for a long time who said, I really try to get, we're supposed to have 10,000 steps per day. She was so hyper-focused on that. And I was grateful that she was trying really hard to be more active and to walk more, but it wasn't in the context of, she had 2 knee replacements. So that 10,000 steps is really for people who don't have that particular limitation. If she could work her way up to that, that would be fine, but she's really pushing to get to that after a very long season of not being able to walk for very long distances. So we need to be gentle with ourselves and recognize that behavioral activation, when it comes from a depression management place, it's part of being able to support where you're at in that moment rather than push you beyond what you can do. One of the other therapy types I wanted to address is very common for people with specific phobias, anxiety, social anxiety, and even eating disorders too. So this is called exposure and response prevention. So it's a form of behavioral therapy. So again, not necessarily focusing as much on thinking or thoughts. Sometimes we can think something, but then that doesn't influence our behavior. And what we're going to do is we're going to try to retrain your brain with having different associations with particular things that typically make you anxious or uncomfortable. So for example, Halloween is next week. Let's say I have a fear of spiders, arachnophobia, yikes. And one of the ways that in exposure and response prevention might be, okay, let's work on a anxiety or fear ladder. Sandra, how do you feel when you look at a picture of a spider compared to how you feel when you see an actual spider in real life? And how can we slowly desensitize your anxious or uncomfortable response to spiders by showing you the things repeatedly? It's a very uncomfortable kind of therapy, but it's very effective. Let me show you maybe those pictures of spiders because they don't make you as scared. Get you comfortable with that and then proceed in other places. Maybe then I show you a video of a spider, and then maybe once we get to a place later, then you might actually see a spider in person. But the idea is that we're gently trying to reframe and retrain your brain's associations. So for example, with obsessive compulsive disorder, it's removing the compulsion. So removing the thing, the hand washing, the maybe tapping things a certain number of times. When you remove the compulsion, it creates a sense of discomfort. That's where the compulsive behavior comes in. But if we can retrain that compulsive behavior and get you to a place of feeling comfortable without that compulsion, then OCD is then made a little bit easier and a little bit better. Well, thank you. Very nice compliment from one of our participants. Thank you. Acceptance and commitment therapy. So this is kind of a newer therapy type that we're seeing. And I kind of love that acceptance and commitment therapy is very, I would say, almost completely different from CBT. So the type of therapy that I perform, which is, like I was saying before, very change oriented, whereas acceptance and commitment therapy is much more acceptance oriented. So struggling with something that you are working with, whether it's your anxiety and depression, maybe you're going to be looking at the function of that. Well, how does that serve you? So for example, with eating disorders, maybe one of the reasons that you feel compelled to limit the amount of food that you're consuming or eating is because for a long time you received a lot of positive validation for being thin, right? So that's assessing the function of why that behavior has been so helpful for you for so long and maybe now isn't. So there's a lot of focus, just like with DBT, which I mentioned before, about mindfulness and looking at acceptance and looking at cognitive flexibility. So flexibility is something that, and curiosity as well, is something that can be really helpful to foster resilience when we are struggling with something. So psychological flexibility could be as simple as, well, I was hoping I'd be able to make it to the doctor on time, but I just hit traffic. Oh, well, let's try to work on that, right? Values are also incredibly important. We want to make sure that all of us have different values, and whether that's values towards our family, towards ourselves, towards our faith, towards any of that, if you can have a life that acknowledges and again accepts your values, that is going to be incredibly important. The other part of acceptance and commitment therapy is the commitment piece. So these are the people who are, I want to make a change. I am committed to doing something different. Boom, you're an ACT person. This is also going to be possibly a good therapy type. Maybe you've had a CBT therapist before or a psychodynamic therapist before, and you didn't really feel like they helped. You want a new perspective. Well, this is a newer therapy. So if you find somebody who has some expertise in this, this might be the person for you. So I'm going to share just a little quick story for you folks. So I was very active in marching band when I was in high school. I absolutely loved it. And so we would often do quite a bit of performances for football games, or we would do marching in the homecoming parade or the Memorial Day parade, all these different kinds of events, right? And we had to hold very militaristic like posture while we were marching. So I played the flute. So we're like this, very upright and uptight. And our director would always say, if it's comfortable, you're probably wrong, right? Because many of us, especially if it was cold or if we'd been standing for a long time, we'd start to slouch. And, you know, that's an effort for your body to get more comfortable. And so he would always say that sometimes you have to be uncomfortable. And of course, that was very much about marching band style and being in a place of being professional and portraying a kind of performance for what was understandable for that. But I use this as a metaphor when I talk to folks about therapy, is we would never want a therapist to push you to talk about something you didn't want to address or you weren't ready to talk about. especially if you have a history of trauma. Nobody should be forcing you to talk about that. And we want to make you comfortable enough in order to do so. And one thing I do want to say, however, is that sometimes a therapist, as they should, be gently pushing you towards patterns or behaviors that just aren't helping you. So for example, I met with a patient recently and we realized that every time he talked to his children, he's using the word should a lot. And we're talking grown adult children, not young children who he's sort of trying to, you should keep your fork on your plate. You should take your elbows off the table, that kind of thing. This was about judgments about their lifestyle choices. And so all of those shoulds were really creating a lot of division in their family. And while nobody really thought that, or this particular patient didn't really see that that was where his behavior was going, but again, it's kind of uncomfortable to hear from the therapist, oh, maybe that wasn't the right decision for me. I've also had to point out to people that they've done things that were somewhat passive aggressive, right? Passive aggressive is really aggressive behavior. It's not, we're trying to communicate something in a way that shows that we're upset about something, but we're covering it up with language that we think makes it okay, with sarcasm. And so I point that out because the way that we communicate is so important to our relationships and our own individual health. So I think it's important that we address it. So you want to invite a level of discomfort into your therapy. You want to be comfortable and vulnerable with the person, but you also want them to push you a little bit with, again, things that may not be helping you. Let's say maybe it's not the way you speak, but maybe it's how much alcohol you're consuming. I'm noticing that your drinking is increasing a little bit more. Can you tell me more about that? That may not be something that you necessarily feel comfortable with, but the therapist is doing that out of place of trying to identify what is functional or not functional for you. Is therapy like it is on television? Yes and no. Sometimes it depends on what kind of a film it is. Obviously, therapy is oftentimes dramatized quite a bit, but the therapy portrayed can often reflect the popular modalities of the particular time period in which it is demonstrating. So for example, we have Mad Men here. I really love the show. And early on in some of the earlier seasons, we have Betty Draper as the character, and she is in what we would consider sort of traditional psychoanalysis of the late 1950s. And so the patient would be laying on the couch and verbally doing a lot of word associations and talking, but the therapist really wasn't very conversational. The person wasn't really communicating a lot towards that person. I think because Freud is such a big part of our cultural context, I think a lot of people are, they think that when they go into therapy, it's going to look something like this, when current traditional therapies are much more lighter and, again, conversational and interactive. So, but a lot of people can be somewhat deterred from this. So to know that, okay, therapy is not like this. It's how it used to be, but it isn't what it's like today. One of my absolute favorite films is Ordinary People. It can be very traumatic. There's a lot of talk about suicide, but the conversations between the therapist and the patient, dramatized as they are, I think reflect a very common type of interaction. You see that there's a lot of active listening from Judd Hirsch's character. They are seated in equal positions. They're both sitting. No one's laying on a couch. We're just having a conversation. And it's human. It's trying to get the human element of the kind of trauma and suffering that we've had and going from there. But there are so many other different types of therapy portrayals. The show You just premiered with season 3 on Netflix. And I had a patient tell me, it's for couples therapy, and that he felt like that the way that therapist did it was so different from how I would, even if I, as I was watching it, noticed, oh, I don't know, I kind of agree with some of the techniques and styles. So take what you will of therapy when it is on television and take it with a grain of salt. Again, if it is a little overly dramatized, but whatever seems comfortable, that's what's going to be the biggest help for you in therapy too. And I just wanted to make sure that I left off, obviously these slides will be made available to you, that we want you to be safe. So during COVID, there's been a lot of mental distress, and I think a lot of people are reluctant to call various hotlines. What does it mean if I call them? I'm going to just be talking to a stranger. But the goal is for you to have somebody to talk to, somebody who, when you are in crisis, when it feels like an emergency, that you can reach out and call these people. So that's the intention. And that's the end of my presentation. And then let's see, we've got just about 20 minutes or so. I had a couple of questions that I had received from participants before, so I'd like to just kind of address some of those. Some of them we may have already talked about in the conversation, the presentation, but then we can go on with any other questions that folks may have for me after the fact. So the first one that I wanted to address is, how do you find somebody who understands sarcoidosis, right? And certainly the specialists for that you are working with specifically for your sarcoidosis could have recommendations for therapists that they've worked with and recommended before. And that's one of the best places that you can get a direct referral from your physician. And that's not just for sarcoidosis, that's for any chronic illness. Maybe your sarcoidosis you feel is well managed, but maybe you have some other inflammatory issue that you feel like that's the thing that's really creating problems for you. So you follow up with that clinician. But really the big thing that you want to look for is somebody who has experience with chronic illness. And the reason that we look for that is because there are a lot of similar themes with various types of chronic illnesses, setting boundaries when you don't have the energy to do something, navigating advocacy with your doctor's office. And there's a lot of overlap in this specific thing. So recognizing, do I need somebody who is a SARC expert, or do I need somebody who just understands the complexity of what chronic illness looks like? And along with that, just like I was saying before, is whether or not you can ask of that particular therapist to understand where you're coming from. Will they be responsive to, like, for example, let's say you're having a lot of symptoms, right? And even if they don't understand it from their own perspective themselves, are they willing to be active listeners and validate the experience that you're going through? Because you could have somebody who's a therapist who has sarcoidosis, and that person still may not be the right fit for you, but certainly something that you can look for. Yeah, and we have a comment, I'm sorry, but there is no one in my area that has any idea about what sarcoidosis is. It's more rare in some areas, and people may not understand what it is. And I think this is also part of that interview process with therapists, to say, one of the reasons I'm looking for a therapist is I want somebody who can help me manage my chronic illness. Let me tell you about what it is, and then gauge their reaction. Are they validating, wow, that sounds like that's really difficult for you? Or do you feel like maybe they are so blindsided by it and not understanding it? So it's the connection that you have with that person that probably makes the most sense. The other question that I had is, how do you tell a current therapist you need to move on? And I think that this is a really great question. I hope that everybody here feels empowered again to talk to your therapist about that. I just had a patient the other day. Trauma is one of the things that I do address quite a bit, but there are certain types of trauma therapies that I'm not trained in. So I've been working with a therapist for about maybe 3 months, maybe about once a week, every other week. And he had decided that at this time he wanted to transfer to a therapist who was trained in this other particular modality. Great. I want to be supportive, and your therapist should also want to be supportive of the type of therapist that you're going to connect with the most. It doesn't do us any favors to try to beg you to stay with us if you're not getting anything out of it. And again, that could be for somebody who has unique training in something that maybe your current therapist doesn't, or maybe you're feeling better and you just want to end the therapy. I think I'm doing okay. Can I contact you if things perk up again? That's totally common for people to say to their therapist. Or again, I don't feel like we're really connecting. And this is something that, again, ghosting is something that a lot of people talk about, is just ending and severing the relationship. In therapy, we know that that's going to happen. And sometimes that happens for very non-emotional reasons. I've had people who have gone back to school or back to work and they just sort of dropped off, and it's because of their scheduling. It's not something personal. But again, that even if you're just not making that emotional connection with that therapist, that's okay too. We had another question. I facilitate a support group and I would like to know what kind of therapy I might suggest and how to find it. And I think that it's one of those things where peer-led groups are so important, and we often care about the people who are struggling with mental health so much. But the thing that I often tell people is that it's not your responsibility to find the kind of therapy for that person. it's the mental health professional's job to do that. So whether that's an assessment with a local hospital, or again, identifying and providing them with support and resources for them to be able to verbalize that, right? Okay, so I'm here as a peer support to you to provide validation, maybe some networking experiences, maybe you know about some clinical trials, you're a fellow sarcoidosis sufferer, and that can be the really empowering role that you have in that person's life. But it's not your job to find the right therapy for them. It's my job. It's the people who have been trained in this to be able to do that. Just like even for physicians who I work with, oh, I really think this is the kind of therapy that they need. I may disagree with them because of the experience that I have. And so to hopefully lessen that feeling of responsibility off of your shoulders. I even had a coworker who approached me last month who said, I have a close friend who's struggling with addiction and I just don't know what kind of therapy she needs. And I said, you just need to be her friend. You don't need to be the person who is saying specifically what kind of therapy she needs to address her substance abuse issue. She needs to see somebody who has experience with working in substance abuse who isn't a friend of hers, right? We want to make sure that whether it's being a facilitator of a support group or whether it's being a friend or a family member, we want to preserve the role that we have in that particular context and not overstep it. So I hope that helps. How to get the most out of your visits. I think this is a great question. You know, even if you're meeting with a therapist only 1 hour a week, you still have so many other hours in your week where you're living life and you're having stressful things happen to you. I have some patients who will send me emails ahead of our therapy appointments to say, I just want to make sure we talk about this. So I actually have an agenda when they come in as their therapist. I want to make sure we address this, we address, you know, all those kinds of things. Some people will create a bullet pointed list and they'll talk about that in therapy too. Oftentimes, and this is also very important, if you're the kind of person who really wants to actively work on things after the therapy session is over, ask for homework. I really love, this is something that Gen Z is very good at. I have a lot of younger adolescents and I have to say, I'm just so impressed with them and their ability to tell the therapist what they want out of the session. Hey, I want to make sure we talk about this. They're very directive, which I think is a good thing. So it's something, it can be even just as brief as carrying, like I said, that bullet pointed list before you go in. That could be very helpful. How do you recommend searching for especially well-rounded therapists with specialties across the life cycle? And I think that this is a really good question. I also think that this relates to the training that different therapists have. So for example, licensed clinical social workers, and I can speak primarily from this because that is my degree, but we specifically have foundational training in how people's lives change across the life cycle. That you would take a full year of that, your first year of your master's program. So the different stages of life and the developmental changes that you have are something that a social worker can definitely talk about. That doesn't mean that the other clinicians don't, but if that's something that you want to address, whether it's a life transition, like for example, menopause, right? That's a life transition. You need to be able to meet with a therapist who has some expertise in that. So whether that's what that is specifically related to, you're going through some kind of life transition, maybe you're retiring, maybe that's the major life transition that you're having, is feeling like you can talk to that particular therapist about that. The other piece of that could also be if you're interested in family therapy. So I need somebody who's that well-rounded that if I wanted to bring in my children into session, they're going to be able to understand and be able to work with them as well. Bring that up. What is it about the life cycle that you're really wanting to address with the therapist? And hopefully that person can help you with that. And then, and I love these, you know, I just think every time I do a presentation for this group, everyone is so educated and very, very thoughtful and well-rounded with their questions, and even going to very specific questions, which I think is very good. Don't stop that, you know, keep, whether it's me or whether it's another clinician, keep asking your very specific questions so you can get those met. One of the questions we have is, I currently have a CBT therapist to work on food and sleep issues. Great, CBT is evidence-based for both of those things. Should I discuss with him other emotional issues or have a separate therapist for more general issues? And I say, start with your current therapist and say, we've been working on a lot of these issues, but I also really want to talk about this. I have a young woman who I'm seeing who is a new mother and felt like we just kept talking about her role as a mother in therapy, but wanted to talk about her marriage. And she also wanted to talk about her career. Great. This isn't my session. This is your session. If you're coming in and you want to talk about all these things, then let's do so. If there is something where maybe you think it would be beneficial to meet with one therapist for one issue and one therapist for another, again, because of the training that they have, then that's a really important thing to discuss. The one caveat that I make to that, when we're seeing multiple therapists, is to make sure that, one, you address, do you want those therapists talking to each other, right? Do you want them to have a integrated and connected relationship to talk about the goals that you have for your therapy, as well as any potential conflicts? So like I said, maybe if you have a CBT therapist for one thing, but you have an ACT therapist for another, you might be getting mixed messages if you're meeting with more than one person. So maybe initially talking to that therapist and saying, we've been talking about my food and sleep issues for X amount of time, but I'm looking into maybe transitioning to somebody else for these other things. Again, is that wanting to meet with two therapists at the same time? Or is that I think that our therapy has run its course for what we can talk about, and now I'm interested in meeting with a specialist for somebody else? Perfectly normal for us to have those kinds of conversations in therapy. And again, it's making sure that we navigate, is it something where this is integrated and we're able to work on these things together? Or is it something where you need to meet with a different therapist and cease your current relationship with your current therapist? And hopefully you may not even have to switch. So I did have another question that had come up. Okay, so we have somebody who has a palliative care therapist and another therapist. Perfectly appropriate. And I like that, because especially palliative care, for folks who don't know, is specifically oriented towards comfort care. And literally palliative in Latin means to cloak. It's like having a blanket of support around you. So you may have different goals with one therapist. And again, palliative is a very specific level of expertise that other I, as much as I love palliative care, I don't have special training in it. So if you wanted to have a palliative expert, then that's good to have that one person versus another. I have one other question that I have that's come up on here and some comments. I had a psychiatrist who said that he disagrees with all my sarcoidosis doctors, that I even have sarcoidosis, and it was so horrible. Really invalidating, right? Especially because if you're coming in to see the therapist for that primary issue, doesn't really help to sort of feel like your diagnosis is being invalidated. Certainly if there's something where maybe we don't think that something is happening and maybe it's something else, I'm not a psychiatrist, I don't have that same medical training, but if I did think maybe somebody was getting direction about something that I didn't think was happening, I might maybe suggest expressing some of that and then having them bring it back to their physicians, right? Not necessarily invalidating the experience. This person said, I have neurosarcoidosis and just found out that my niece has a neurological disease with a pressure in her head, and how can I help her without being a problem? And this is a really good example of something that we talk about in therapy when we're talking about communication with one another. So you can always ask her, how can I help you? One of the paradigms I use with a lot of my patients is, do you want one of these two S's? Do I need support or do I need solutions? Right? So if you are also suffering from a neurological issue, you might be able to help your niece with networking or finding the right kinds of clinicians for her. But maybe your niece doesn't feel like she needs help with that. I've got all of that covered, auntie, or uncle, whoever it is, but I do need somebody that I can just vent to. I'm in a lot of pain right now. I'm feeling so much pressure and I just need to talk about it, right? And have somebody come back to me and say, wow, that must be really hard. So to know that we can ask people for what it is that they need. Sometimes we can take initiative for some things that talks about whatever it is that, like, for example, we can take initiative and maybe help them with things that we all know that when we're going through some kind of crisis, we need help with. So for example, people often need food. If you're in crisis, you don't maybe want to cook as much. So maybe you offer them some gift cards or something to help them with practical things. Maybe that's the thing you're going to do. But other than that, you can always ask people for what it is that they need help with. Yeah, and the person is responding, my niece is a psychologist, and I told her not to be afraid to go to a psychologist herself. This is another area where, like I mentioned before, oftentimes therapists are also now, because of COVID, being looped into that place of being labeled as a first responder. So if there are therapists in the area that have expertise with that, there are also therapists who will advertise that they have expertise working with other therapists, right? You know, I like working with people who are in healthcare, so that's pretty important. I had a question, is there a credible website that has a list of therapists in the area that shows their specialty training that you covered? Yes, Psychology Today allows you to filter based on the specific interests that that particular person has and what they are trained in. Usually too, let's say if you are to get a list of therapists from the physician or from another website or something, and it's just names and addresses, I think you would be hard pressed to find a therapist who doesn't have a website or maybe even a Facebook profile with which you can identify from that website what kind of therapy they practice. Not everybody is going to list it, but again, in your interview stage, when you're looking to consult with these various folks, to say, I'm looking for a therapist who has training in acceptance and commitment therapy. I went to a seminar and a webinar, and based on that, I thought that might be a good fit for me. Is that something that you do, or something else that you do, right? That could be another area that helps you with that. It's one of those things you can search whether or not somebody has an active license. Every state has a licensing board, so you can determine if there were, you know, how long have they been in practice? Have there been any disciplinary action on that person's license, that kind of thing. But we don't yet have anything that's necessarily, other than, again, Psychology Today is probably the biggest one. That is a place where we can look at whether or not the person practices in a particular specialty. The other thing that I would say is, for some types of therapy, there are certifications in them. So for example, dialectical behavioral therapy is a particular certification that you can get through Behavioral Tech LLC, which is based out of Seattle, Washington. And there are listings where you can type in your zip code and look for a therapist who is trained in that. So if you want to work backwards, and rather than look for the therapist, you can also research the type of therapy, and then you can look and see if there's somebody who's registered in the website or, again, certified in that therapy type. So either start with the therapist and their name, and again, something like Psychology Today, or search for the therapy type, see if you can find somebody who has expertise in that. And thanks, Mindy, she shared the Psychology Today website. Always good.
Yeah, thank you so much, Sandra. And I want to just be mindful of our time, because we are at that right at that 90-minute mark now. And so wanted to give folks one last chance. If you have a question, go ahead and pop it in there. But I just wanted to say thank you so much for this presentation. I think it was really awesome.
Thank you.
I know we get questions that you answered throughout the session today. I get questions every week from patients and family members. So it's such a hot topic, and I think this session was really excellent. And as I mentioned, folks, this has been recorded. We're recording it now, and we will make it available along with a PDF version of the slides from Sandra. So.
And truly, I want to be a resource to everybody. So if you do have more questions, or if you have kind of a sticky situation for, you know, certain purposes, I can't be your therapist, right? If anybody has questions for me, but if I can direct you to somebody, or if I can just provide a little bit of, you know, I have a lot of people who come to me and say, is it okay for me to talk about X with my therapist? Or I had this kind of a reaction. And yes, you know, we want to have permission, but sometimes we just don't know how to phrase it. How do I bring it up to this person? And I can certainly help with some conversational stuff. So maybe if they go through Mindy or somebody else in the organization, I can always sort of be kind of a consultant. I won't charge for that.
So thank you so much, Sandra. Yes, if you do have a question for Sandra outside of this, just email me. Everybody has my email, because it's all over all the invitations to these events. So, and Mindy@stopsarcoidosis.org. So awesome. Well, thank you so much again, Sandra. And we hope everybody has a wonderful weekend, and we will see you next time.
Thank you for being here, everyone. Have a good one. Bye.
Bye-bye.